Have you ever wondered if your back pain was actually due to something more than just normal back pain? I'm Dr. Rena Malik, urologist and pelvic surgeon, and today we're going to talk about urologic causes of back pain. 4 surprising things you probably never thought about. If you're new here, I make content every single week on things like bladder health, sexual health, and so much more. Make sure you subscribe and share this channel with your friends so everyone can learn and educate themselves. There's several things that can cause back pain, and I want to touch on today 4 different things that in urology we see that can cause back pain. Number 1 is something I've talked about quite a few times on my channel, is kidney stones. So kidney stones are little tiny calcifications that can be found anywhere along the urinary tract. Typically, they can be found in the kidney, in the tubes that drain the kidney, or the bladder. Sometimes you can have symptoms, and other times they might just be there and not be bothering you at all. A lot of it depends on exactly where they're located and the size of them. But typically, people who present with back pain and kidney stones will notice a couple things. One, they'll have pain in their upper back or their flank, and that pain may radiate from their back all the way down to their abdomen, sometimes even radiating into the labia for women or the testicles or scrotum for men. This pain is usually pretty sharp and severe and comes and goes. And if you're passing a kidney stone, I've been told that the pain is as bad as giving birth. You can also have pain with urination or blood in the urinary tract, so you might see blood in urine. And sometimes this is accompanied with nausea and vomiting. If you think you might have a kidney stone, particularly if you're having pain that can't be controlled with pain medication at home, you're having a fever, chills, nausea or vomiting and can't keep food down, or having pain with urination, make sure you come to the emergency room. Even young, healthy people can get very, very sick if that kidney stone is obstructing or blocking the urine from flowing to the bladder. And so you definitely want to get to the emergency room as soon as possible to get evaluated. Number 2 is not very different in the way it presents to kidney stones. It's called pyelonephritis, and this is an infection of the kidney tissue. Very often, again, it presents with pain in the back, in the upper back, called the flank. But usually people feel really, really bad when they have this. They'll feel chills, nausea, vomiting, fevers, usually higher fevers than you'll see with kidney stones unless they're obstructing. This can make you also very, very sick. Sometimes you can get away with seeing your doctor in the office and getting antibiotics and getting taken care of with antibiotics at home. But in some cases, it might require that you get antibiotics through an IV or a line into a vein into your arm. And needing these IV antibiotics may require you to be admitted to the hospital. And a couple reasons you might get hospitalized is if you're not responding to antibiotics by mouth, or you're very, very ill, where you might have a very high fever, not be able to eat or drink anything, or have a very high heart rate or a very low blood pressure. These are signs that you may be more sick and need observation in a hospital. Also, if you get a culture, a urine culture back, and it shows a bacteria that is resistant to oral antibiotics, meaning that it cannot be treated with antibiotics by mouth, then you might require what's called intravenous antibiotics. Number 3 is pelvic floor dysfunction. I talk about this one a lot. Pelvic floor dysfunction is extremely underdiagnosed and undertreated, and it's a very common cause of a lot of problems that I see. The muscles that sit at the very bottom of your abdomen, called your pelvis, these make up your pelvic floor, and their job is to hold up all the organs on the inside, the bladder, the rectum, the small bowel, and the uterus for women, and also plays a role in things like defecation, which is having bowel movements or going poop, urination, or in women, holding a pregnancy or holding support in the vagina. And sometimes people can carry a lot of stress in their pelvic floor. Just like people get a tight jaw when they get stressed and they might have clenched their teeth at night, similarly, you can be clenching those muscles in your pelvic floor. And if you are doing that, you might get symptoms. And some of those symptoms can include back pain, which of course is what the purpose of this video is about. But also you can have difficulty urinating, or sometimes you can have overactive bladder, like you're going to the bathroom more often or more frequently. So urgency, frequency. Sometimes you can have constipation or difficulty emptying your bowels. And other times you might just experience pain. For women, pain with sex, or for men, pain with ejaculation or pain with erections. And so if you are experiencing these situations, the best thing is to see a urologist and talk about these issues. And ideally see a pelvic floor physical therapist who can help you treat these problems and help you relax the muscles in the pelvis and teach you some exercises to help with that. And number 4 is a rare one, but certainly something to look out for, especially if you have a family history of prostate cancer, is actually prostate cancer can present as back pain. And this is for a couple reasons. So one is because prostate cancer, when it spreads to bones. And specifically in prostate cancer, one of the bones that it spreads to is in the spine. And in fact, in patients who have advanced prostate cancer, meaning those who have prostate cancer of high stage, can actually have back pain in 60% of patients. So things to look out for if you're having back pain, have a family history of prostate cancer and other symptoms such as having blood in the urine, weight loss, having difficulty urinating, and occasionally just other urinary symptoms like going to the bathroom more often, having urgency, or having issues with erections. All those things together can be signs of prostate cancer. And luckily, the screening is pretty straightforward. It's a simple digital rectal examination to make sure we don't feel anything abnormal on the prostate, and also a PSA, which is a prostate-specific antigen, a blood test, which is a screening tool that tells us what your risk of having prostate cancer might be. And based on that, we can have a discussion with you about what the next steps are. So with all 4 of these things, certainly the first 2, you will obviously know that you have something else going on because you might have urinary symptoms or fevers or chills or other things. And with pelvic floor dysfunction, you may know, but you may not know because you might not have any other symptoms. So with all 4 of these things, it's very likely that you're going to have back pain with other symptoms. But sometimes it's hard for people to realize that, hey, maybe these 2 things are connected. Your back is over here and your bladder's up here. Why would an issue with one be related to an issue with the other? So it's important to talk to your primary care doctor, and if you're concerned, see a urologist. Make sure that you get evaluated and see if there's anything we can do to help you. Overall, I hope this was helpful, and as always, remember to take care of yourself because you're worth it.